I'm Dr. Herzog, and this is Dr. Esteban Leon. And today we're going to walk you through our day and show you what we do here at Implant Center of Miami. What we're doing today in this case is we're doing an uncovering. And when a patient has their implants placed, we typically leave them in the bone and covered by the gums for 3 to 4 months, and in some cases longer. So, I have Dr. Leon here. What do you look for to see if an implant is ready to be uncovered?
I take an x-ray and see if we see nice osteointegration, and usually it takes about 4 months, especially if I also look at when it was placed, if we had primary stability and how it torqued.
Great. Yeah, so those are some really important things to know to see how long you should wait for the implant to be integrated, and then we can look at the x-ray, like he said, to see if the bones have integrated in between the threads of the implant. So now we know that the implant's integrated, and now it's time for the procedure called uncovering, or sometimes they called it a second surgery. So do you mind walking us through what that's like?
Sure. It's very minor. We put a little anesthetic in the area. We infiltrate the area with anesthetic, and then we punch a little hole around the implant, and we put what's called a healing abutment. So the tissue can heal for about 2 weeks around the actual healing abutment, and then we'll put the real abutment, which will hold the crown. 2 weeks after that, we can take an impression, and shortly after have the real crown.
So in this case, we did 5 uncoverings on this patient. She had implants done all over her mouth, and they were all really well integrated. And one of the implants actually was so well healed that the bone grew over the top of the implant. So it's kind of a hassle for us when that happens, but it's a really good indicator of healthy implants. And so we don't mind taking the extra step to go ahead and remove that little top layer of bone when we have to. In some cases, we'll use a tissue punch, like Dr. Leon explained, and in other cases, we'll just make a small incision. Some sites will need a suture or two, and some sites will just be held open with the healing abutment and don't need stitches at all. So do you typically prescribe antibiotics or anything for that procedure?
No, I typically do not.
Right. So just a little saltwater rinse, and then see you in 2 weeks for the digital scan.
Right.
Well, I'm going to introduce someone to you very talented and very special who is here now in the Bay Harbor location. This is Dr. Esteban Leon. Welcome, Doc.
Hello, thank you so much. I feel very welcomed, and I'm excited to be here, part of the team. It's a wonderful team, and I feel right at home.
Tell us some of the things that you love to do.
I love to place implants and do cosmetic cases, veneers and crowns. But I feel home here because I really love surgeries, and I love the technology that we use here, like PRF and different technologies and stents and surgical guides.
Now, Doc, you have how many years of experience now?
20. I graduated in 2004.
Okay, so he has quite a bit of experience here, even though he looks pretty young. And you've worked at different places, different states. Tell me, be really honest.
Yes.
The technology that you've seen in this office, is it any different than anywhere else?
Yes, it is, especially what I was saying now with the PRF and a lot of people don't use surgical guides, and here we pretty much prioritize that, so minimize errors, and we use CBCT scans, and we use guided surgeries, like I said, and scans.
What about how about for veneers or aligning teeth? Anything new and fascinating?
Yes, amazing labs that we're working with here. One of the labs is really good for veneers, where we actually can prep and finalize the delivery at the same time at the second consult. We pretty much don't have to prep the first visit, and we design everything with 3D scans and scanners, and we deliver the case and prep at the same time. So we try to do minimal preps, and the same thing with the 3D Predict, which is another technology that we use for aligning teeth, where we actually can move roots and also use the 3D scans and the CBCTs.
You guys know I love technology, and so I'm excited to see a doctor with so much experience really getting his hands on this stuff, and we're so happy to have you here. welcome. And
Thank you so much. I'm
Yep.
happy to be here.
So that one though back there, just so you know, it's a very curvy root.
This one?
16.
Oh, okay. So it's gonna hurt more.
So no, it's not. It's just gonna take a couple extra minutes.
Okay.
Take a deep breath in. Okay. Okay, so this is a patient who has tooth number 16 that needs to be extracted. Number 16 is what we call a wisdom tooth. And wisdom teeth are not very smart, dental joke, but actually they cause lots of problems. I was on the phone with my oral surgeon today and we were talking about how we wish everyone would just take them out when they're teenagers because it makes for a lot easier surgery and a lot less complications as you get older. I personally only had one wisdom tooth taken out, and I have another one that's in there that is now dangerous to take out because it's wrapped around the nerve. So I'm no longer a candidate to remove that wisdom tooth, and that could create complications. In this case, this is a very simple extraction of the wisdom tooth, although there was a curved root. So there was a chance we would have to do a surgical extraction. And all we did was numb the patient with local anesthesia, and then we elevated and luxated the tooth. That means that we put pressure on it to expand the bone. The whole procedure took, I think, less than 1 minute. And then we drew blood and we placed PRF. Dr. Leon, can you explain to us what the PRF is, or how we do PRF?
PRF is we use the patient's own blood cells and clot factors to help them heal better. And when we put it at an extraction site, we prevent complications, help the healing procedure.
So some complications that you can have from a wisdom tooth extraction, one very common one is a dry socket. And that's when the blood clot is dislodged from the socket. So for example, if the patient spits and the blood clot comes out, that could cause the dry socket. If they smoke or if they do any kind of suction action, for example, drinking through a straw. And so that's really important part of the post-operative care is not to do any of those things that can dislodge the clot. It could be the natural clot or it can be the growth factors that Dr. Leon is explaining about. The root canal was on the top tooth, the front one?
Here. Yeah.
Yeah. Okay. Go ahead.
So let me put it here a note so we can have a
Okay.
cancellation on Thursday. So I'm just
Yeah,
waiting.
he had to come on April.
It's so long.
I had to ask this upstairs.
Although I'm not getting anything here. Muerde? Mm-hmm. That's right. It looks really beautiful. Okay. Let me check the bite. Right. Mastica. Tap, tap, tap. Mastica. Ahora. In this procedure, we are placing 4 implants in a dentulous site. Edentulous means you don't have teeth and the bone is ready and primed to place the implants. So this patient has a little bit more bleeding than we usually see, and that's due to some biologic factors that the patient has. But you can see that we go ahead and we make our initial osteotomy, or some people might call it a pilot hole in lay terms. And we make sure that we like our angles, that we're in the center of the bone, that our distance between implants and teeth is sufficient. And we'll go ahead and make those pilot holes and then go to the sequential drills until the hole is wide enough without disrupting the cells and the bone to place the implant. So one of the things you'll see is that there's lots of water, and the saline in the water cools the bone so that the bone doesn't overheat. If you overheat the bone can die and cause other complications such as failure of an implant. So you'll see lots of water and cooling of the bone, and then you'll see the implant placed at the end. So we're placing 4 implants. The bone in some areas is narrow, so we're using different sizes to account for the different width and depth of the bone in this case. And then you'll see me doing a continuous interlocking suture with PGA sutures, and that is going to allow for swelling. The way that those sutures are placed, it allows for a little bit of swelling without the sutures tearing. It's also very clean suture, so it doesn't harbor bacteria like the old silk sutures did. And it's very strong as well. So some flexibility to allow for the swelling, but it still has that strength. So it's a really nice high quality suture. And then the technique that I'm using, it's continuous, so it goes all the way across and it's really just one thread.